to Orchard Barn. I'm Dr. Sally and I'm posting from home today as I'm self-isolating. My son's just come back from Thailand with a cough, so unfortunately I've got to stay inside. But just to let you know what's going on behind the scenes at Orchard Barn. So first of all, happy Mother's Day to everybody, wishing lots of best wishes to all the mothers out there. And just to let you know what's been happening. So as you know, some of the therapies we've had to close and the shop, but the online shop is still working and is absolutely fine. And myself, Alison and Jules are doing Skype consultations or phone consultations for everything now. So there's no problems with those consultations. Also, I've managed to access finger prick testing for the hormone blood tests. So they will be sent out and we'll be able to monitor people, your hormones for the bioidentical hormones without any problems too. We are just also busy developing an online program which is going to be going out very soon, some new Orchard Barn products, and I'm writing lots of blogs and content for the website. We already have a dedicated section on the website all about the coronavirus, how to support your immune system, loads of useful resources on staying healthy, and we're going to be adding to that over the next few weeks with lots more useful content and hopefully a really supportive and helpful resource for the local community and anybody who needs it. We can also signpost people to other areas and resources if they need to as well. I've also been really busy working with an NHS strategy group. In fact, we just won an award last weekend, which is very exciting, and have got more funding to push this project forward. This is all about supporting doctors in the front line and basically helping to support doctors in terms of their mental health, building trauma resilience, and really supporting people who are working in very difficult environment at the moment. I was already working on this campaign anyway, but it just feels like it's really the right time to push this forward, and that really at the moment all the medics and amazing NHS staff really need our support. So I'm very busy working on that too. The other thing to come from that is just to really reiterate the social distancing rules that we all need to follow. Lots of my colleagues work on the front line in A&E and GP surgeries, and everything I'm hearing from them is that it's really difficult at the moment. The resources are stretched to the maximum, they're working under extreme conditions, and they're really asking for everyone to just stay at home and to be really careful with making sure that you don't spread the virus, because we just, the resources are really stretched already, and we really have to look after each other, and especially the vulnerable people in society and all our NHS workers who are just doing such a fantastic job. So I really wanted to say that, that I feel that's a really important thing to make sure everybody understands why we're doing it. And this is why we closed the shop and have obviously stopped lots of the therapies as well. So just to kind of also say that we're going to be bringing out an online program soon, which is going to have lots more interesting and useful content, which I hope will support you. And just to reassure all my patients that my clinic will carry on as normal, obviously just via Skype or phone consultations. I have volunteered to go into frontline practice if I need to, and if I get called up I may end up working in hospitals or doing whatever is necessary, but I will absolutely ensure that my clinic continues, so please don't worry about that. And I look forward to being supporting the community and basically being able to help as much as possible over the next few weeks or months in making sure that we all thrive and do the best we can to stay healthy and happy, and supporting the community and all our NHS staff. So just wishing you well